User question: what are long-term implications of leadless pacemakers in the interactions with multiple devices within the cardiac chambers? ChatGPT. Thought for 8 seconds. The implantation of leadless pacemakers represents a significant advancement in cardiac rhythm management, offering solutions to some of the complications associated with traditional transvenous systems. However, as with any emerging technology, particularly when involving multiple devices within the cardiac chambers, there are important long-term implications to consider. Below, I discuss these implications in detail. 1. Device interactions and electromagnetic interference. Sensing and pacing interference. Crosstalk between devices. When multiple leadless pacemakers are implanted, e.g., an atrial and a ventricular device, there is a potential for electromagnetic interference between the devices. This can lead to inappropriate sensing or pacing behaviors, such as oversensing, detecting signals it shouldn't, or undersensing, failing to detect necessary signals. Synchronization mechanisms. Manufacturers have developed communication protocols to mitigate these risks. For instance, the devices use wireless communication to synchronize atrioventricular (AV) timing and prevent crosstalk. However, the long-term reliability of these synchronization mechanisms over many years remains an area of ongoing research. 2. Thromboembolic risks. Increased risk of thrombus formation. Device surface and thrombus formation. Each implanted device adds foreign material to the cardiac chambers, which can serve as a nidus for thrombus, blood clot, formation. The presence of multiple devices may theoretically increase this risk, particularly in the right atrium, where blood flow is slower compared to the ventricle. Clinical implications. Thrombi in the right heart can lead to pulmonary embolism if dislodged. While current studies have not shown a significant increase in thromboembolic events with leadless pacemakers, long-term data are limited. Anticoagulation considerations. Patients may require anticoagulation therapy to mitigate this risk, which introduces its own set of considerations, especially in elderly patients or those with bleeding risks. 3. Endocardial and structural changes. Fibrosis and endocardial damage. Local tissue reaction. The implantation of devices into the endocardial surface can lead to local inflammatory responses, fibrosis, or scar formation over time. Multiple devices increase the amount of endocardial surface area affected. Impact on future procedures. Structural changes could complicate future interventions, such as valve surgeries or additional device implantations. 4. Device retrieval and replacement challenges. Difficulty in extracting leadless pacemakers. Limited retrieval options. Unlike transvenous leads, which can be extracted via specialized tools and techniques, retrieving leadless pacemakers is more challenging, especially after endothelialization, when the device becomes embedded in heart tissue over time. Multiple devices increase complexity. If a patient requires device replacement due to battery depletion or malfunction, and multiple devices are present, the retrieval process becomes more complex. Risks include cardiac perforation or damage to surrounding structures. Abandonment strategy. In some cases, non-functional devices may be left in place, abandoned, and new devices implanted alongside. Over time, this could lead to a significant device burden within the heart. 5. Imaging and diagnostic implications. Interference with cardiac imaging. Echocardiography. Multiple intracardiac devices can create artifacts on echocardiograms, potentially obscuring visualization of cardiac structures and impairing diagnostic accuracy. Magnetic resonance imaging, MRI, although some leadless pacemakers are MRI conditional, meaning they are safe under specific MRI settings, the presence of multiple devices may complicate MRI compatibility and safety considerations. 6. Battery life and device longevity. Limited battery life. Finite device lifespan. Leadless pacemakers have a battery life that varies depending on device type and pacing needs, typically ranging from 8 to 12 years. Multiple devices mean multiple batteries that will deplete at different times. Replacement planning. As devices near end of life, planning for replacement becomes crucial. The challenges of device retrieval or adding new devices must be considered, especially in elderly patients or those with comorbidities. 7. Unknown long-term effects. Lack of extended follow-up data. Relatively new technology. Leadless pacemakers have been in clinical use for less than a decade, and dual-chamber systems have even shorter follow-up periods. Long-term effects beyond 10 years are not yet fully understood. Potential for unanticipated complications. Rare or late-onset complications may emerge as more patients receive these devices and as follow-up durations extend. 8. Impact on cardiac function. Hemodynamic effects. Altered blood flow dynamics. The presence of multiple devices could theoretically affect intracardiac blood flow patterns, potentially leading to turbulence or contributing to thrombus formation. Valvular interactions. Devices implanted near cardiac valves may interfere with valve function over time, though current designs aim to minimize this risk. 9. Infection risk. Device-related infections. Reduced but not eliminated risk. While leadless pacemakers eliminate the pocket-related infections seen with transvenous systems, they do not entirely eliminate infection risk. Endocarditis involving the device is possible, and the presence of multiple devices could increase this risk. Challenges in treatment. Infections involving intracardiac devices are serious and may require complex interventions, including device retrieval under high-risk conditions. 10. Economic considerations. Cost implications. Higher initial costs. Leadless pacemakers are generally more expensive per device than traditional systems. Implanting multiple devices increases initial costs. Cost-benefit analysis over time. Potential reductions in complications and re-interventions may offset higher initial costs, but long-term economic analyses are needed.